Oh, I just clicked on something. Hold on, everybody. Okay. I'm sure you guys see something. Give us 1 second while this loads on my computer. It's taking longer because everybody's on the internet. Okay, Launch Lab Online. Welcome to our second Facebook Live today. I'm Liz Marion, your community manager if you don't know me. And we are joined by Phaly Pichota, who not only is our Boston City leader, she's also the founder of Cibus Health. And amidst this uncertain time and kind of crisis outbreak of COVID-19, specifically being in the health industry, Phaly, you have an interesting perspective on this, but also you have an ask for our community. But if you can just introduce yourself, if you didn't catch her breakdown, it's from December, it's still in our video section. But just tell a little bit about your company and what you guys are doing.
Hey guys, I'm Phaly Pichota. I think I know a few of those on this community. I'm currently the Boston City leader in Boston, but I am currently actually out in California. I'm a little bit bi-coastal, but my company Cibus Health, which we founded about 1.5 years ago with my fellow co-founder, we do medically tailored meals to patients who are leaving the hospital, particularly as relevant to their home care. And we actually don't make anything. We are an aggregator platform that connects existing healthy meal producers that are very specific to a patient's nutritional needs, whether they service like chronic conditions such as diabetes and congestive heart failure, et cetera. We basically source those out to our producers who then deliver those to our patients who are in self-recovery. So that's a little bit about what we do. We find ourselves sort of in a unique position at this point. We're 1.5 years in. We're still pretty much developing our beta, and our technology has not been fully developed. But we've been working with Boston University's Institute of Health Systems Innovation and Policy, and they're really interested in actually utilizing us to help their patient population. Now, we had a collaboration going on with them before COVID-19 kind of started to materialize. And now what we're finding ourselves in is a position where they are looking to refer patients who come in to Boston Medical or patients of the BU Medical School who have come to the hospital, have symptoms of COVID-19, and are being told to go home and self-quarantine. Now, a lot of these patients who are in self-quarantine at the advice of their physician or caregiver, they have a lot of like chronic conditions or pre-existing conditions that make them sort of fall into this high-risk bucket. And I think that's where we kind of help in. They're looking at us to kind of support their patients' nutritional needs that are in self-quarantine, and also not only support their nutritional needs, but also help in sort of helping their chronic condition. This does a couple of things for them. It really helps with alleviating the stress in our healthcare system that we're seeing through a lot of people coming into the hospital. And it's also, it's a much safer avenue for people to be able to go home, self-quarantine, get their meals, get their healthy meals, and try to recover without either introducing the infections into the hospital community or getting a secondary infection. So they're trying to mitigate that exposure. And it's a great, I think, idea to kind of, implement right away, because we're in this kind of like, it's almost all hands on deck right now at the hospital settings, and they're just looking for ways to alleviate that stress and that pressure on the healthcare system. So.
And so, apart just from basically the meal planning, right, that they're needed, and it is interesting to bring up just a point that people might not know is that a lot of people with COVID-19 symptoms are being just told to go home and self-quarantine if they're not critical. But what are the different initiatives that they're also asking you to do in order to put something in place for all of these people to basically have access to healthy meals, nutrition, but also, basically telehealth, right? Like that's what we're talking about here.
Yeah, and I think this was the piece that we hadn't expected to plan for, and that was something really new. But our BU medical team contact said, we'd really love it if you can do or implement some check-ins, and that includes either call-in check-ins or video check-ins. And they had explicitly requested video check-ins that we could potentially, the patients that are referred to us that are being in self-quarantine and are getting meals, they'd like to know, how are they feeling? Are their symptoms getting worse? And those video check-ins could actually be a huge value add for our clinicians that are in the front line, and funnel them through to telehealth. So telemedicine or telehealth, which is a really big buzzword right now, so that they can actually triage and actually reach the patients that need the highest level of care, at this point, because the resources are very stretched. And I think that that's the whole point of this, is that if we can create a process flow sort of at the front end, that we can take all of this patient feedback, so they're not individually calling the hospital lines and not being directed to the level of care that warrants those symptoms. Then I think that this is like the most amazing thing that we could do to help our healthcare community at the moment. And that's something that's really our ask of at this point in time, is that we find ourselves in a position of need. And we find ourselves in a position where we don't have the expertise and the resources at this point in time to actually rally and come together. And so while we were focused on nutrition, we're being asked to kind of go above and beyond that nutrition component of health. And so we're looking for people who, our thought process around this was, well, what if we can create a call center model where someone calls into a central line, gets vetted to volunteers that actually exist within our local community, or a community of people who just are taking the phone call and saying, okay, what can I get for you? What do you like to eat? What's your chronic condition? And where do you live? Is it a single family home? Is it an apartment complex? How can you lift? Do you have a refrigerator? And those types of things that we're asking on the front line, so that we can ship those meals. And then also later on, that same person could actually call that patient, after a couple of days of being alone, to say, how are you doing today, Mrs. Jones? Or to just to do a check-in. And it's a really human thing to be able to, call somebody, especially someone who's sick, in self-isolation, and may not have anybody to talk to. So my ask of the community, I'm looking for volunteers. You don't have to have healthcare experience or anything like that. It's really is to be able to do an intake, and possibly, if they're willing, to basically reach out to that patient. And we call them our customer, and to really just do a wellness check, and that wellness check, I think for folks in the military, we know what that means. It's like, this is a buddy check, and to say, hey, how are you doing? What can I help with? What do you need? Do you have concerns that I can funnel up sort of the triage change, so that we can get someone who has the right skill sets and the right expertise to kind of help you. If symptoms get worse, what do you do? And I think there's just a lot of confusion, and I think that's a component we hadn't thought of that I think would be fabulous. And I thought, in hindsight, I think, oh my God, how great would it be to connect veterans? Because what we do, this is what we do. We reach out to people, and we care for one another, and we protect. And I think this is just another mechanism of doing what we normally do in the military, and doing it in the civilian sector, of giving back to our community. So
absolutely. And and also with the majority of us, I think vast majority, I know you and I are in California, but are kind of under a stay at home, so we are all working from home. Life is different as we know it. So can you give us kind of just an idea of what the workflow and the time commitment looks like for potential volunteers? And like you said, just mention again about the experience they do or do not need in order to contribute. Yeah.
So, as I'm thinking about this, like, fitness and wellness coaches are great. People who have had a little bit of medical experience would be fantabulous, like a military medic or a corpsman, or SARC individuals, people who are like focused on mental health and wellness and well-being. And then just anybody who just really cares, and I think, if you're a mom or whatever, you know how to care for your child, right? And I think these are just natural instincts that are in all of us. So from a skill set perspective, I think we can take a number of people, and what that commitment would look like is if we get enough people, and depending on the patient flow on the front end, we would love to like match you with a 1-for-1, like a one patient. You do the check-ins, and it's a 2-week quarantine period, so you may do maybe 2 to 4 check-ins per person. So that's really the idea that we're having, is like, can we match somebody in our community with a patient who is actually in self-quarantine, getting those meals, a one-for-one match. And I don't think it's all that expensive. It's just making that human connection on a very personal level, just virtually,
Absolutely. And do the hospitals have any idea of volume right now? I mean, I know that we can see numbers of cases, in
Mhm.
the news, but that might not necessarily be translating to what you're talking about.
Yeah, we actually don't know, but our contacts at BU have indicated that we should be expecting a lot of volume. Like, and our intent is really like, we have a capacity limit as well. Like, where our intent is to be able to give 25 healthy, medically tailored meals free of charge, 20 to 25 patients for 2 weeks. So we want to basically get 25 patients from the hospital for a 2-week period that really need this. And we think that there's going to be a demand that's over in excess of that. And how we treat those is still obviously a discussion, whether we charge for those, or we're just trying to find the most vulnerable people and giving them a solution that they wouldn't otherwise have. And I think that that's part of our funding mechanism. We need to create another way on, like, okay, people who want this service and can pay for it, that's a separate channel. But at the moment, we're just tackling, our goal is to do 25 with BMC and BU. And then if this model works well, we're having an ask from a colleague of mine working in a Seattle hospital to deal with Seattle as well, which are two sort of big epicenters of this pandemic in the U.S. anyway. So I want to make sure that we can roll this out and be successful with a sort of a volunteer check-in. And it's also a beta for us, on how we do it. Is there a demand for it? Can we assess the value proposition around this with just this small subset of this beta testing in Boston, and then rolling that out maybe in a better way, a second test in Seattle. So this is a learning opportunity for us, but it's also an opportunity we see as a way to give back.
Mm-hmm.
We were going to spend this money anyways, and we just said, okay, here's this is the biggest need, and we're happy to do it. So, and we will spend that money. We will find those 25 patients, and I think we'll find them quickly.
Right. And also, one of my questions, I guess, would be, do you need to be in Seattle or in Boston, or can you be anywhere in the United States?
You can be anywhere, because remember, this is really video or telephone check-ins. The reality is that a lot of the vulnerable populations over the 65 don't have video. They don't really use video all that much, unless they have an iPhone and so forth. And I think in this population, they tend to use landlines. So it's really a telephone check-in, and it requires a person that can actually reach out to a perfect stranger that they never knew, right? And having that courage to reach out and say, I really care about you, and to also be vulnerable yourself. So that person is already in a vulnerable position. So the volunteer also needs to be able to convey their vulnerabilities, because this is probably something new for both sides to do. And a lot of people may not be comfortable in just calling a perfect stranger and saying, I really care about you, and I just want to make sure that you have what you need. How are you doing? You know what I mean? And volunteers are not going to be going into this blindly. There'll be scripting involved, some guidance on what are the questions to ask. So we're sort of doing that back end work right now to say, okay, we get X volunteers, we get 25 volunteers, and we match them to 25 patients. What does that entail? What is the scripting involved, and how do you see it playing out?
Mm-hmm.
So, and I think there's also an opportunity to make a friend actually who's in need, and so I think it really benefits us all, especially in these really social isolation. I call it really physical isolation, but
social distancing. Right. And so when do you anticipate the start of this being?
I'm actually working on it right now with BU. I think we hope to have the process mapped out by end of the week, Saturday, Sunday, but so it's tomorrow, essentially. Send it to BU and see what they think. They have also a couple BU med students, public health students that are really, they want to volunteer as well. So, but I was thinking about, is there a way to loop in another community that I'm part of, which is the military community, and I think, and it's also a really high trust community. That I can count on. So I think that this could be a very good pairing of that model.
Absolutely. Well, Polly, is there anything else that we should know about this, and encouraging all of you to look at these different volunteer opportunities? I think specifically being in our military connected community, we are definitely well equipped to do this. And while we are all kind of homebound, we should think about ways that we can give back to the other community. And Polly, certainly, I mean, you can count me in if you need a volunteer. I will volunteer.
Thank
I'm
you.
there. I have no problem, as you guys know from being on Facebook Live, talking to random people. So, so I'm happy to do that.
Thank
But yeah, but
you.
anything else we should know?
No, it's just that, I love our community. I am part of that community, and anything that you can volunteer or give back is so much appreciated. And in return, if there are folks in your networks, in your personal networks, whether it's your mom and dad who's living by themselves that need nutrition support, let me know. I think these are the people I want to take care of. This is my community. You guys are my community, and if I can help any way, I'm happy to do it. I think these are really, really challenging times. I also think it's a really inspiring time, to kind of, I have seen such amazing people step up and do incredible things, and I want to be able to support everybody who's doing the best they can, and so. Like I said, anything I can do to help the community, let me know. I'm happy to do it. So.
Awesome. Well, and as we have proven and being, part of our All In campaign, as you guys know, and that's why I put Polly Share as our Give and Get thread, our virtual Give and Get thread, which she just proved of what she needs, and then also, what she can also give as support to our community. So thank you for sharing, and I will drop Polly's contact information into the chat so you guys can contact her if you are interested in volunteering. And like I said, as a community, we can all step up for one another. So thanks, Polly, so much.
Absolutely. Thank you, Liz. Bye, guys. Stay safe and healthy.